Hello and welcome to the weekly vaccine update from DuPage County Health Department. We're looking at the first full week of April to provide you an update on our activities. A reminder that we're looking to reach at least 80% of our population of individuals over the age of 18. And to do that, we would need to vaccinate over 572,000 of our residents. As you recall, we are looking to immunize and fully vaccinate at least 80% of our residents over the age of 18 years old. And to do that, we need to reach and fully vaccinate over 572,000 individuals. As of this week, nearly 35% of that population, or over 325,000 residents, have received at least one dose of COVID-19 vaccine, and 20% of our residents have received the full vaccine complement. So if it's Pfizer and Moderna, it's 2 doses, and if they've received Johnson & Johnson, it's 1 dose, but they are considered to be fully vaccinated. We continue to receive about 20,000 first doses per week, which is our average now for the last 4 weeks. We are receiving 19,360 doses this week into the county. Again, we could easily vaccinate many more people, over double that amount. However, our allocation, like the rest of the state and the country, is mismatched to the demand that we're seeing here locally because there's simply not enough vaccine being manufactured at this time. Now, that said, we anticipate that manufacturing will continue and that it will go up by about 1/3. But with this limited doses, we continue here in DuPage to prioritize individuals who are at higher risk of severe outcomes if they contract COVID-19, or if they have employment or jobs that create an increased risk of running into someone who has COVID-19. You will see that we have, over this past week, increased the number of total doses that have been administered to DuPage County residents. And by we, I'm talking about the big we, not just the DuPage County Health Department, but all sites across the county and, in fact, even the state who have been vaccinating DuPage County residents. So we're up over 500,000 doses that have been administered. Again, we increased by nearly 28,000 the number of our residents who are fully vaccinated. And again, we increased from 17 up to 20% of our population who are now considered fully vaccinated. You'll see on the right-hand graph that the trend line of individuals who are DuPage County residents who have been vaccinated continues to climb. And again, that number is completely contingent upon the vaccine supply that's coming into the state and to the county. You will also see that DuPage County continues to lead our Collier County partners, and we are very excited that Cook County is closing the gap because the more of Illinois residents, the more of our regional residents who receive a vaccine, the better and more protected all of us will be. You'll also see the gender demographics as well as the age demographics continue to expand. And for gender, you'll see increasing numbers of males who are receiving the vaccine. You'll also see that our race and ethnicity demographics, although they're getting a little bit better with information being provided to us, we still have significant issues with collecting that accurate information. So we continue to work with both our vaccine providers as well as the Illinois Department of Public Health so that we can very confidently assure that our Black and brown communities are receiving this life-saving vaccine. Speaking of populations that have been disproportionately impacted, you'll see that we've focused not exclusively but strategically on our over 65-year-old residents. Again, we have about 81% of our residents who are over the age of 65 who have received at least one dose, and nearly 58% who have received both doses. Now, if you're an individual in that age range and you're still waiting patiently for your vaccine, we are coming, and we will continue to we'll continue to prioritize this age group as we move forward and eligibility expands further. You'll see on this graph that as a county, DuPage has been successful, again, because of the sites across our county and across our state with reaching our over 65 population. You will see that as of April 4th, we have over 71, almost 72% of Illinois residents who have received at least one dose of the vaccine. But in addition to the vaccination metrics, we're also watching ICU bed availability. We're watching new COVID-19 hospital admissions, as well as the total number of COVID patients in the hospital setting. And so these next graphs really indicate that we have a ways to go before we can take that next step into the bridge phase as a state. So on the far left, you will see that the number of available and staffed ICU beds across the state, again this is being maintained above the benchmark needed. However, when we look at new hospital admissions, as well as hospitalized patients with COVID, we see very concerning trends that are actually going in the wrong direction. So you'll see a significant increase in the number of new admissions, and then you'll also see that not only are we admitting patients, but the patients are having to stay in the hospital for a period of time, which is adding to the number of hospitalized patients that we have. Now, on the far right, you'll see that our mortality is stable for individuals who are contracting COVID-19. However, last week, when this chart was unveiled to us or released to us, we actually had been seeing a decline. So although we're still in the green for this metric, we are also seeing some trends that are concerning to us and make us redouble our efforts to prevent the spread of COVID-19. Again, we've talked about the various ways that you can become fully vaccinated in DuPage County. We've talked about the distribution as well as the different doses. In week 15, you'll notice for the first time that we actually received an allocation of Johnson & Johnson vaccine. We are being told by both our state and federal partners to expect that this vaccine supply will be even more unstable and erratic, that Johnson & Johnson vaccine will be in the upcoming weeks, and then we should be on a more level playing field with that. Again, we have the capacity within DuPage County, if we were to receive sufficient quantities of vaccine, to be reaching many, many times the number of individuals we currently are. So we are ready, and I think that's an important component and a message as we go in and see the vaccine eligibility and hopefully vaccine supply expand. Again, the regional vaccine sites, the MassVac sites, not only do we have one here at the DuPage County Fairgrounds, but we also have other regional vaccine sites that are within comfortable driving distance for our residents. Those are listed here, and we would encourage residents who are interested in getting a vaccine to to check their eligibility and check on vaccine supply at those sites as well. This graph represents the number of doses that we have been receiving, and you will see that in the orange on the far right of this graph, you will see that we are going through a slight decline in our anticipated allocations. We're actually hoping that as vaccine supply increases on a federal level, that translates to more coming to the state of Illinois and the more coming to DuPage County. Again, we want to make sure that all of our residents have access, so we continue to include and really focus on communities and populations with high social vulnerabilities. Again, we're currently, as of this week, we are vaccinating individuals still in the 1A category, in the 1B category, in the 1B plus category. And again, as of Monday, April 12th, any individuals 16 years old and up will be eligible to register for a vaccine. Again, an important distinction, you're eligible to register does not necessarily mean that you will get a vaccine. In fact, it's highly unlikely in DuPage County that you will get a vaccine on April 12th or 13th. But again, we will be working through our list and making sure that anyone who wants a vaccine has availability and gets that vaccine. A reminder, if you are interested in getting the vaccine, where to register, we have our website. We have a phone number for you to call. If you have questions, if you need to change your appointment that you've scheduled with us, that phone number is a resource for you. And finally, our tools, our communication tools. As more people become eligible, they may have new questions about the vaccine, and they haven't been thinking about the vaccine because they haven't been eligible yet. Now, as the eligibility expands, we want to make sure that everybody has access to credible, reliable, and definitive scientific information. There is lots of misinformation, social media about this vaccine, and we very much want to encourage people to use our website, where we've curated, collected, and developed tools, education tools, based upon the best science and the most rigorous testing information that we have. Now, you will see, and I mentioned that statewide we are seeing an increase. This graph indicates that we are also seeing that increase in cases at a local level. So our 7-day rolling average for all COVID-19 cases reported from the third week of April or March till the first week of April has increased by almost 40%. That's a concerning trend. Clearly, it doesn't meet the wave or the surge that we saw earlier this year in the latter part of 2020. But we are seeing a 16% increase in the 15 to 19-year-olds. The most significant increase is coming in our 20 to 39-year-old age group. But also there's a 50%, which is also significant for the 40 to 59-year-old age groups. All of this to say, as we work our way through individuals who need to get vaccinated, we very much need to be addressing and continuing with our prevention practices, making sure that we stay masked, our faces are covered when we're out in public, that we avoid crowds, particularly indoors, and that if you're not feeling well, regardless of if you've had the vaccine or not, that you stay home. With that, I thank you for your attention again this week. I would invite you to send questions to the email address listed there, and I look forward to providing you an update next week. Thank you.